Hey guys, I'm Carson and this is Dr. Clint Muench with Keystone Orthopedics based in Northfield, Minnesota. So, people are wondering, when should I consider knee replacement surgery? What are some telltale signs?
So I think when you feel like you've exhausted non-operative treatment, so you've tried all of the activity modification, the anti-inflammatories, the over-the-counter pain medication, therapy, braces, injections, and you're kind of at the end of your rope, then it's like time to get it done. If you no longer enjoy doing things in your life that you used to love doing because your knee is slowing you down, then it's time to get it done.
Got it. Can you tell me how previous injuries can lead to arthritis and eventually possibly knee replacement surgery?
So meniscus tear can increase your risk of developing arthritis. So an injury in your teenage years or later, 20s, 30s, can predispose you to develop arthritis later in your 40s, 50s, 60s. So meniscus tear is a big one. Then ACL tear is even worse. So if you have an injury in your teen years or early 20s, you're playing sports, you tear your ACL, you have that reconstructed to reduce your risk of developing arthritis, but your risk is still higher than if you wouldn't have torn your ACL. If you have both an ACL tear and a meniscus tear, then your risk is even higher. And then the reason we do ACL reconstruction is to try to reduce that risk to develop arthritis and go on to need knee replacement surgery. If you don't have that done when you're young and you still do those at-risk sports or those at-risk activities, then your risk is probably the highest. That's like through the roof.
Yep. What do you think are some of the most important questions to ask your surgeon prior to having a knee replacement?
Well, I think the first question is, do you do knee replacement, right? Or how many do you do? Or how many have you done in your career?
Right.
Are you comfortable with the surgery? I mean, that's an important question that a lot of patients don't ask. And I think it's an important one to run by your surgeon. They're not going to be offended, right? So if you only do one knee replacement a year, well, and you've only been practicing for a couple of years, then, that's not a very experienced surgeon. At this point in my career, I do lots, we do them every week. And so I've done hundreds, probably thousands at this point in my career.
And lastly, what does post-op recovery look like? How long does it take? And how long does a knee replacement last?
Post-op recovery is tough. That's kind of the catch. When we're talking to patients about knee replacement surgery in the office, you get to the point where, okay, you need knee replacement surgery. Then we discuss, well, what does that look like? And then we get to this question. And I usually tell people, this is where the recovery is super difficult. Like the first 2 weeks, you're thinking, why did I do this? This was not what I thought it was going to be. There's that much pain. That's why the recovery is really difficult. So we spend a lot of time working on therapy to regain motion, regain strength. And by 6 weeks, people are still swollen. They still have stiffness. They still have weakness. They still have soreness. And so they're still at 6 weeks kind of wondering, did I make the right choice? It's not until about 12 weeks where people finally start to say, okay, now I know why I made this decision. Now I know why all my friends that have had it done are happy. And then, but still it takes probably, a good 3 to 6 months or even out to a year for some of the symptoms to finally get better. Your strength takes a long time to get better. Long after the swelling is gone and your range of motion is good. And then modern day knee replacement should last 20 to 25 years. The materials, especially the plastic, is so much better than it was back in the 1990s, even early 2000s. That plastic wore out sooner, and today's plastic is really good. And so they last a really long time.
Awesome. Well, thanks, Dr. Muench. Again, I'm Carson, and this is Dr. Clint Muench of Keystone Orthopedics based in Northfield, Minnesota.